Next guest is an award-winning author. He is a lawyer, Wesley J. Smith, a senior fellow at the Discovery Institute, and an attorney for the International Task Force on Euthanasia and Assisted Suicide. Wesley, why don't you come join me here? You know, the president has pledged that existing laws regarding conscience protections and all these things will remain in place. He made this in a speech last night, but one of the first things that he addressed in trying to dispel the concerns about the bill was the issue of the assisted suicide issue, the life-ending counseling. And that's something you've been working quite a bit on. Do you think the president gained any ground last night in his speech?
Well, pardon me for bickering with the president, but I don't think he was really straight with the American people. There is no assisted suicide in the bill, that's true. Mm-hmm. The end-of-life counseling could end up being directed towards senior citizens having self-rationing. But the real problem here is it's not just the bill. We just heard Congressman Boehner talk about a 1,000-page bill. That will lead to 100,000 pages of regulations. The bill is the skeleton. The regulations will be the flesh and blood. And my real concern, my chief concern, is that this is going to lead to the kind of centralized rationing, not only over a public healthcare system, if there is one, but also over a private system, because these centralized cost-benefit boards or best practices boards will apply also to private health insurance as well as public health insurance.
So wait, let me make sure I'm clear on that. So what you're saying will happen is, regardless of whether it is a government plan or a government option, as we're talking about here, the government's going to define the benefits. So they're going to basically say what the rules are, and the private companies have to play by that if they're going to be in the exchange.
Well, you're going to have, all the private insurance companies are going to have to be in the exchange if they're going to sell health insurance after, I think, 2014. And these cost-benefit practices boards are going to control what will be covered and what won't be covered. And that's going to not just end up, in my view, deciding what is covered, but who is rationed. Why? Who is going to be on these control boards? Bioethicists. What difference does that make? They tend not to believe in the sanctity of human life. The predominant view in bioethics today, the bioethicists from Harvard and Yale and Princeton, such as Peter Singer, isn't a sanctity of life ethic, it's a quality of life ethic, where the value of a person's life depends on their cognitive capacities, the value of life, their age. We've seen Ezekiel Emanuel, Rahm Emanuel's brother, who's the head NIH bioethicist, has suggested that if there's scarce resources, age-based rationing, he didn't call it that, but that's what it would be appropriate in scarce resources. He said, well, I'm not saying we should do the whole system now, it's premature, but what he's doing is he's laying down a gauntlet saying this may be a way to go for controlling costs. Realize this whole agenda is about controlling costs. And even the president early on, when he was a little more candid, I think, was saying things like, well, when grandma needs some treatment, maybe we ought to talk about the pain pill. The agenda is clear. In fact, Senator Daschle, who is, the New York Times has called the most influential person in this entire health care debate, back when he was expected to be the head of Health and Human Services, had a piece in the Wall Street Journal. And he wants to model our health care plan on something in Britain, the UK, called the Institute for Health and Clinical Excellence, called NICE, which is a centralized rationing board, which, for example, just in the paper the other day, was denying the best treatment for osteoporosis for elderly people based on cost-benefit. Cass Sunstein, who's probably going to become the president's rationing czar, has talked about the life of a younger person being worth more than the life of an older person in terms of cost-benefit analysis for regulations. So the people that have the president's ear, the people that will be in the regulatory bodies helping make these policies, are clearly going to push us toward healthcare rationing.
And what is repeatedly said in this city is personnel or policy.
Yes.
People who hold those views will ultimately, it will be seen in policy. Now, Wesley, in the committee process, amendments were offered that would have prohibited rationing.
Right.
Those amendments were voted down.
Defeated. And by the way, notice how the president talked about how allegations that we were going to kill off senior citizens. No one is
ever said that.
Accusing anybody of saying we're going to kill off senior citizens. But there is going to be rationing. How are you going to control costs when you're adding tens of millions of people for coverage and then claim that you're not going to change any kind of benefits. It just doesn't make any sense. But again, Senator Daschle, who is the most influential person in this advising the president, according to the Wall Street Journal, called for a federal health board modeled on the Federal Reserve to rate medical products and create central controls on access. Controls on access equals rationing. The president needs to be straighter with the American people. And again, it's going to be in the 100,000 pages or so of regulations which are not going to be subject to town hall pressure, which is not going to be in the public debate, done in the back rooms, done in the darkness of the bureaucratic process, which will be the flesh and blood of the rationing that you won't see in the bill because the members don't want to be pegged for that.
Right. I think it's a very important point because if you look at the bill, no specific procedure is discussed in the bill. As you talked about, it's kind of like the president's speech. There's no specifics. What is specific is that there will be a commission that will define what the benefits are and how the whole system works. And you're right. It's beyond political input and pressure.
That's correct.
So unless these things are specifically stated in the legislation,
do not ration.
Right.
Do not ration what and do not ration who. And with regard to the end-of-life counseling, why don't they put in the bill specifically that it's voluntary both as to the patient and as to the physician? In fact, there's a bill that's not the House bill but a Senate bill in which physicians would not get paid unless they did this kind of activity. Also put in there...
Now let me stop you because some people may miss that. This is the end-of-life counseling that kind of...
In the House bill.
Right. But there are certain states, there's 3 states right now in which assisted suicide is actually legal. And the bill does state that they're to be counseled according to state law. So in those 3 states, they could very well be counseled about physician-assisted suicide.
I do believe that amendment just was passed that would not allow or would not force that. I think it would certainly permit it. But by the way, do you know who's a big part of creating the Section 1233, the infamous 1233, which is the end-of-life counseling? Compassion and Choices, also known as the Hemlock Society. They have bragged on their website how very much a part of this process they've been. And the congressman who put it forth has been a very enthusiastic supporter of assisted suicide. This bill does not contain assisted suicide, but the thrust of some of the people behind it is pretty clear to me.
It's, again, personnel is policy, and what they've been pushing clearly is behind the scenes in this bill. What is your sense? Is there any chance that an amendment would be accepted that would state very clearly, as the president is promising, it's not in here? I mean, it sounds like a simple solution. Just simply take an amendment that says there will be no rationing.
And it's very important because if a bill has a specific mandate, the bureaucracy can't overturn it. So say there will be no rationing. On end-of-life counseling, say it will be purely voluntary and not result-directed or not direct result-oriented. Senator Kennedy, the late Senator Kennedy and Senator Brownback, put in a bill that passed and was signed into law by President Bush saying that if a woman gets genetic counseling because she's been diagnosed with a Down baby, that counseling is not to be outcome-directed or outcome-oriented, but to be neutral. And that was because studies found that women with that diagnosis were being pushed toward the abortion option. Why not put the same kind of language in the end-of-life counseling measure that Senator Kennedy and Brownback put on genetic counseling? Then the bureaucrats couldn't overturn that, and you couldn't have some of these advanced directives, which are result-oriented, which do push a senior citizen into what might be called self-rationing.
A very good point, because a lot of these folks are kind of they're discouraged, they feel desperate, they don't want to be burdens on their family.
Isn't it an amazing thing that we now, and senior citizens feel this all the time, I don't want to be a burden. Right. How have we made it so that elderly people will feel like they're a burden? What have we done as a society to make them feel unwanted? That is something we have to look at beyond this health care bill.
Wesley, thank you for joining us. I appreciate your insight on this issue, and it is certainly one that we have been and will continue to track.
Thank you, Tom.